Did you have surgery and then start experiencing a burning sensation and tingling that weren't there before? Or did you have an accident? And then, near that scar, do you feel burning? Do you feel it sting? And no matter what you do, in fact, the more physical therapy and massage you do in that area, the worse the pain gets. Then, this video is for you. Folks, we call a nerve injury that affects sensitivity and subsequently causes pain a painful neuroma. Perhaps you heard this term from the doctor you consulted, who, upon tapping your scar, noticed a little shock running down your arm or leg, and that this was causing your pain. We have a nerve that provides sensitivity in various parts of our body. So, any injury, any cut, any surgery performed near the nerve that provides sensitivity can cause damage to it. And then it tries to grow at that injury site and it can't. And it forms a fibrosis, a scar that becomes tight. This scar is like a short circuit. And it sends information to the brain in that region which previously showed sensitivity. So, for example, if I am going to perform surgery on my arm and I cut the nerve that provides sensitivity to my hand, I form a painful neuroma. In the nerve of my thumb, my big toe, what will happen? When moving the arm or touching that neuroma region, I will feel pain, a burning sensation, a stinging, a tingling in the thumb. Why? Because the neuroma will send information to my brain in the region that was my thumb, and then I will feel pain. Therefore, it's like a short circuit. That's why I say I'm an electrician neurosurgeon, because I end up having to reconnect the cables so that you improve your symptoms. But let's get straight to the point. Watch the video until the end, because I will talk about all the available treatments for the painful neuroma. First of all, we have to start with medication. The medications available today do not reconstruct the nerve, meaning your nerve will not reconnect just because you are taking medication. So, Etina, vitamin B12 will not help. The articles do not show any benefit. However, we need to control the pain so that it does not become chronic. Pregabalin, gabapentin, nortriptyline, amitriptyline. These are medications that we use to reduce the intensity so that the nerves feel things less and consequently you feel less pain. Doctor, but won't I regenerate my nerve? Why should I take a controlled medication to improve this pain? Because if you have neuropathic pain for a long time, your chances of resolving this pain decrease. And even if you undergo surgery or a procedure later on, if you have been suffering a lot from burning, shocks, tingling, your chances of getting rid of this pain decrease. Studies show this. The greater your experience of pain over time, the lower your chances of being free from it after you undergo surgery, for example. So, don't have prejudice against medication. Use them. Sometimes they cause some side effects that go away after a few days, but they are extremely important, even if they don't regenerate the nerve. Consider the following. If you take medication for the pain, you don't improve sensitivity because your nerve doesn't reconnect, but your pain decreases after 3 months. Can you wean off this medication? Life goes on, because the problem today for you with the painful neuroma is not a loss of movement, but rather the pain it is causing you. Dr. Thomas, besides medication, what can I do to improve this symptom? Is there anything? Physical therapy, massage, exercises? He has. So, releasing that neuroma region, for example. If my neuroma is here in the arm, I can do a release, a massage around it, movements to try to free it from that adhesion. If it moves freely, it won't bother as much. So, warm compress massages, physical therapy. This can help you free that nerve from the scar and consequently improve the sensation of pain you're feeling. And then we can also perform blocks. We take a small needle with ultrasound and administer medication around it to free it from that adhesion. Additionally, the corticosteroid and analgesic medication help to relieve the symptom. If you had the block, it helped to improve the pain, and the next day the pain returned completely as it was before. We have a positive factor, which is the medication. It really works because there is a neuroma, but a negative factor is that it didn't help, it remained the same. Then, you might have a surgical indication. If you block this nerve and you had a 40% improvement, then you do physical therapy and it helps more, 20%. More blocks of this nerve can help. So we perform several blocks and then surgery is not necessary. In the cases we handle, the block only improves at the time of the analgesic and then the pain returns. Then it's the surgical procedure. Folks, When you're going to have surgery for a painful neuroma, seek a specialist in peripheral nerves. You've already had a nerve injury, tried to treat it with specialists who weren't experts in the field, you didn't get a good result, and now this surgery is extremely important to improve your quality of life. Don't make a mistake in choosing the doctor, because if you choose a professional who doesn't work in the nerve area, your chance of resolving this surgery is very low. Your chance of resolving your pain with this surgery ends up being very low. What do we, specialists in peripheral nerves, do to improve your painful neuroma? We make a small incision in the area. Where this nerve is, we cut this neuroma from the tip, that is, this short circuit that is at the tip. We cauterize the tip of the nerve so that it doesn't reform. And we place the nerve in a region where there is no movement, free from adhesions. So that when you move your arm, move your leg, you don't have that neuropathic pain symptom. Does this solve the problem 100% of the time? No. I have had patients whom I had to operate on 3 times to improve the neuroma pain. Painful because the neuroma would reform and I needed to reposition it again. However, it is extremely important to try, because living with neuropathic pain for the rest of your life is extremely bad and debilitating. Don't let this pain become chronic and have your procedure done, if necessary, as soon as possible. Everyone, I hope the treatment for painful neuroma is clear. If you're suffering from this problem at home, don't forget to like this video and follow my channel for more information.